Good morning and welcome to our Alaska Collaborative on Health and the Environment teleconference titled Protecting Children at the Top of the World, Reflections and Recommendations from the Alaska Children's Environmental Health Summit. Our guest presenters today are Elise Miller, Director of the Collaborative on Health and the Environment, Pam Miller, Director of Alaska Community Action on Toxics, and Waghiyi, Environmental Health and Justice Program Director for Alaska Community Action on Toxics. My name is Diana DeFazio, and on behalf of Alaska Community Action on Toxics, I'll be facilitating today's call. CHE Alaska is a regional partnership group of the National Collaborative on Health and the Environment. CHE Alaska aims to advance knowledge and effective action to address growing concerns about the links between human health and environmental factors. And you can find more information at healthandenvironment.org, and that's all spelled out, and they've just launched a brand new website, which you should definitely check out, or on ACAT's website at acaction.org. And again, I did send a link to the PDF of Elise Miller's PowerPoint presentation last night. If you don't have that document in front of you, please send me an email at diana@acaction.org, and I'll send you the link after I finish up with the introduction. In early October, Alaska Community Action on Toxics convened the Children's Environmental Health Summit in Anchorage. This was the first of its kind conference in Alaska. The goal was to address growing concerns about the disproportionate exposures to environmental contaminants experienced by children in the circumpolar north. Our speakers today will discuss what happened at the conference and what comes next in our efforts to protect children at the top of the world. We are so pleased that Elise Miller, the Director of the Collaborative on Health and the Environment, agreed to discuss CHE's work and share her reflections on the Children's Environmental Health Summit. Without CHE Alaska wouldn't exist, and we certainly wouldn't be where we are today. Nearly every month for the past 11 years, CHE Alaska has hosted an environmental health teleconference. We've explored many topics, from the latest scientific research on toxic chemicals to policy initiatives to community-based environmental health and justice efforts. To date, CHE Alaska has held well over 100 calls with some truly incredible speakers. Thank you, Elise, and everyone at CHE. We greatly appreciate the leadership and support of the National Collaborative on Health and the Environment. And now it's my honor to welcome and introduce Elise Miller. For nearly 25 years, Elise has been dedicated to improving human and environmental health by serving in leadership positions in the nonprofit sector. Currently, she is Director of the Collaborative on Health and the Environment, or CHE, an international partnership of researchers, health professionals, and advocates committed to strengthening the scientific and public dialogue on the impact of environmental factors on human health. Elise also serves on the board of directors of the Endocrine Disruptor Exchange, or TEDx, and was named on the National Advisory Board of the Children's Environmental Health Network after 12 years of service on the network's board of directors. In addition, she is a member of the professional advisory boards of 4 other nonprofits in the environmental health field. And Elise holds a master's in education from Harvard University. Welcome, Elise. You may go ahead and begin.
Thank you so much. It's truly an honor to be invited to be on this call and at this summit. Please know that we at CHE are so very grateful that ACAT holds the CHE flag, so to speak, in Alaska and hosts these calls on cutting-edge research and topics that are so critical to growing awareness and galvanizing actions on environmental health concerns. So I feel just so grateful to have you all as a partner and doing such important work. So I'm going to begin by telling you all a little bit more about CHE and what we do. And if you go to the second slide, please. I'll just start with a few, shocking and statistics, which I'm sorry we always have to begin with, but that's the reality. And pollution kills 3 times more people than HIV, malaria, and tuberculosis combined, and that's according to a report by the Global Alliance on Health and Pollution. And even the World Health Organization recently reported that 2/3 of global deaths are from pollution, and that's up from just 1/4 of global deaths from pollution that they reported on 15 years ago. So whether that's better reporting or different kind of criteria, I don't know, but the fact of the matter is that pollution is just a huge concern, and we're putting so many more resources into sort of downstream and more focused efforts that can be important, but are not necessarily going to prevent the chronic disease and disabilities that we're now seeing. So the collaborative started in 2002. We have over 5,000 members in 93 countries in all 50 states. We provide all kinds of services. I'll talk to you about that in just another minute. But I first want to give you, on the next slide, slide 3, kind of overview of what we hold as our philosophy. And that's really that this work has to be done on a systems basis, or create a systems or ecological approach to health. And so on our new website, and I'll talk a bit about that as well, we've created this logo or graphic that describes the different environments that can impact our health or lead to diseases and disabilities. And so each of these buttons that you'll find on the website clicks into these different environments, and I'll show you some examples in a moment. But mostly we try to be a global learning community, and we do that in different ways. We have our own conference calls on various topics, some which certainly relate to what's going on in Alaska. We also provide listservs, or what we now call science serves, that you can participate on, where the latest science is posted and people discuss that. We have a bunch of other publications that I'll mention in a minute. And so basically we're kind of the NPR, I kind of call it, the National Public Radio of environmental health, and that we're really trying to get the science out there, make some analysis that is useful so that it can be translated into better regulations and stronger public health policy. So on our next slide, slide 4, I just wanted to highlight a few of the results of Che's work over the last almost 15 years. And one of the ways that we've been able to advance this field is to bring together the scientists in a particular area and examine the scientific literature on the environmental contributors to these different health problems and create these scientific consensus statements. And so that has really helped leverage further action. So, for example, we worked with a number of scientists and health professionals and people concerned with fertility and reproductive health issues, and there was first a scientific consensus statement with the researchers saying yes, the environment is or toxic chemicals can be a contributor to reproductive health problems. And then out of that grew the first major academic program in the U.S. on reproductive health and the environment, and that's based at the University of California, San Francisco. And I believe Tracy Woodruff has spoken on one of ACAT's calls, and she's with the program on reproductive health and the environment at UCSF. So that's an example of how getting the science out there can help move more of the academic work and the research dollars that go to funding that, as well as getting more information to communities. And another example is we worked on the President's Cancer Panel. For the first time, the President's Cancer Panel was focused on environment in 2008, 2009, and they had been formed. This panel had formed in 1976. So every year there's a panel and a topic for discussion, but they had yet to talk about the environment and cancer. So we were able to help pull together a lot of the information, suggest experts to provide testimony, and what emerged was this very hard-hitting report saying that we are doing injuries and grievous harm, I guess was the term it used, to the American public because we're not looking at preventing toxic exposures. We've also worked extensively with a lot of the National Learning and Developmental Disabilities organizations and helped them learn about the emerging science so that they could be spokespeople for stronger regulations. And we've developed a number of publications, and I'll talk a bit more about a story of health. But first I'm going to just give you a brief overview of our new website, because I think it's just a great resource, far more streamlined than our last one, which was like a dinosaur. And what I think is most valuable about it, and I'm on slide 5, and then let's go ahead to slide 6, is that we take that graphic you saw at the beginning with the different environments. So it's the chemical environment, the food and agricultural environment, the built environment, psychosocial, socioeconomic, global, technological. So we have sort of landing pages on each of those, which gives an overview, and so that you understand how these different environments are interacting. And it's never just one, of course. It's how they interact, and then on the individual level as well as the population level. And so on our slide 7, you'll see here under the chemical environment, you'll see lots of different chemicals where we have extensive information and literature. These are just screenshots, of course, but if you go down further on the right, you'll see materials about our various publications, as well as links to organizations and other entities that are doing significant work in that particular area. There are, on the left side, there are different science serves you can join on CHE if you want to learn more about it. There's also a list of the related calls you'll see and related news on that particular topic on every single page. And so the whole site really reflects an ecological model of health where everything is interconnected to everything else. And it's complicated, but we hope that what we've done here is to streamline for those who visit the site so that they can easily find what they want. And so I'll flip through a couple more of these screenshots. Page or slide 8, here's the reproductive health research and resources. And then on slide 9, we have the learning and developmental disabilities research and resources. So I think that will allow people to get the science they need. It's in a lay language. You can always go more deeply into the scientific literature, but we wanted to make sure it was accessible to pretty much everyone who speaks English anyway. Unfortunately, ours has not been translated to any languages at this point. So on slide 10, I'll mention some of our publications. The San Francisco Medicine Journal just came out a couple weeks ago. This is their December issue, and this is what we call the CHE issue. So every other year, San Francisco Medicine basically publishes an issue around environmental health issues and features many of our CHE colleagues. And as you can see on this slide, this one talks about everything from environmental health literacy to climate change to obesogens to neurodevelopment and tobacco and so forth. So that's on our website. You can click it open and look at the different pages, along with 60 other publications that we've done over the years. So I encourage you to look at those. So one of the, I think, most useful publications that we've developed recently, and it's still an ongoing project, is A Story of Health. And this is an award-winning multimedia ebook that is now housed on the Centers for Disease Control website for continuing education credits for health professionals. But it's available to anyone. And what's unique about it is the basis of it is a family reunion where there's different generations involved and people from different backgrounds, and then there are case studies on some of the individuals at this family reunion. And the first one, and that we feature here, is a story, what we call Brett's story, which is a story about asthma. And so as you go into A Story of Health ebook, there's explanations. You can dig deeper into, there's thousands of resources listed if you want to get, original research. And there's also just videotapes and other interactive graphics that I think are helpful for anyone to be able to get the information, even on the community level, for this kind of work. We've done, so our first story was on asthma. Our second story is focused on Stephen's story, which is about childhood leukemia. The third is Amelia's story about learning disabilities. And then our next case study or chapter will be coming out in 2017 on reproductive health in the environment. And so we are very pleased that in addition to the multimedia ebook, Story of Health is being put into forms which will be much more accessible to community groups as well. And they include a wonderful new video that's just come out called Love in the Time of Toxicants. And it's done in a shadow puppet display. And it's these wonderful interactions and dialogue around a couple who are getting together and they're going to get married and thinking about having a baby, and some of the conversations that come up around what types of exposures they might want to avoid and that kind of thing. In addition, there's, based on the Story of Health as well, is a comic book version. It's called Rosa and Carlos Get Married, and that's still in production. But the video is now in English and Spanish because it's being piloted in California. And I can send the link to Che Alaska so that you all can look at that video if you wish. And we're hoping, of course, that it will be successful and then get out to lots of other communities, including those in Alaska. So very excited about that. So, excuse me, I'm sorry, I'm losing my voice a little bit. So slide 12, I want to get to the sort of meat of this conversation about the Children's Environmental Health Summit that ACAT hosted in October, which was just extraordinary. And so it really is telling a story from an Alaskan perspective, and it just was really moving for me. I think one of the most striking features of the summit was how the agenda beautifully wove together Western science and indigenous experience and wisdom, both being essential for building an understanding of what the challenges are and what interventions need to take place. It reflected the kind of systems approach to health that Che tries to articulate by featuring the many different interacting environments we experience I've just described. And in many meetings I attend, there are mostly researchers and a few NGOs, but the summit that ACAT organized was a rare opportunity to hear firsthand the experience of those who live day to day with health impacts from toxic exposures, as well as from other toxic stressors such as abuse and lack of access to medical services. And next slide, number 13. I pulled out the pictures of these amazing women. Many of you on this call probably know a lot of them, if not all of them. And they were so powerful when they spoke. I felt like they embodied, their truth-telling. They were authentic in expressing both their grief and their hope. And one of them said, our elders are our scientists. And that was very apparent from what was shared. And I just know in a lot of scientific conferences I attend, there are people on their cell phones and on their laptops or whatever and not really listening to the speaker. But at this conference, when these amazing women told their stories, you couldn't have heard a pin drop. It was just incredibly moving and compelling. And just as a side note, along these lines of really weaving together the science and indigenous wisdom, I'm reading a book, Braiding Sweetgrass, which some of you all may know of, Robin Wall Kimmerer. And I've been very moved and inspired by how she holds both her Western scientific training and the process of reclaiming her indigenous roots and understanding. And her language is just poetic. So if you want to put that on your Christmas wish list or something, I highly recommend it. But I think it reflects a lot of what the ACAT conference was trying to capture. So another experience of the summit I was touched by was that it was an opportunity for healing as well. So there was all this research that people spoke to that was riveting in its own way and really critical. And then there were these stories and insights and wisdom from many of those who they live in Alaska. And on top of it, there was an opportunity for healing. And that certainly doesn't happen at scientific meetings I go to or congressional briefings and so forth. And so that, I think, was such an important addition or integration of these other ways of knowing and understanding. And I was particularly struck by Kathy Sanchez's ritual around the stones of grief, and powerfully expressed how unspoken pain accumulates over generations and the consequences for health, physically and mentally and spiritually. And she also showed how the seeds of hope come forward over generations as well and can provide the opportunity for healing. And I personally felt deeply transformed by that ritual. And if you go to slide 14, here's me, a picture of Kathy Sanchez, and it's just very, very touching. So in short, I found this meeting embodied all the elements we need to make progress towards a healthier future. And now, of course, is the hard part, acting on the specific recommendations that emerge from the summit. And I believe Pam will describe those in more detail in a minute, and then we can have a further discussion about those towards the end of the call. But for now, I'll simply close by saying that collaboration with lots of different stakeholders, even when everyone holds the same mission and goals, can be incredibly hard at times. And I think we all know that. And particularly having to work on a shoestring makes it that much more challenging. But the dedicated efforts that ACAT and its partners have been making is what it takes. And I personally hope that the momentum gained from the extraordinary events like Standing Rock these past months will provide support and energy for similar efforts all over the country, and very much including Alaska. So I thank you for your attention.
Thank you very much.
I'm sorry, one last slide. In slide 15, I just have to, this is my son, and he's here with our 2 kittens and Bunny. And so there's interspecies cooperation here, and everyone's getting along. And so I just wanted to show this, and certainly wish you all a healthy and peaceful holiday. So I will close there.
Okay, thank you very much, Elise. And as Elise mentioned, we will have some time at the end for discussion. But before we get there, we are going to hear next from Waghiyi. And so I'd like to invite her to offer her reflections on the summit, but let me tell you a little bit about her first. Vi is a Yupik grandmother who was born in Savunga on St. Lawrence Island. And since Vi joined ACAT in 2002, she's worked closely with villages on St. Lawrence Island and in the Norton Sound region of Alaska, where military waste continues to contaminate fish, wildlife, and people, and where persistent organic pollutants from around the world are accumulating in the Arctic food web and in traditional foods. And Vi works with researchers, community health aides, and tribal leaders to protect environmental health and ensure justice. She frequently travels to speak at national and international meetings about ACAT's environmental health and justice work. And Vi currently serves as ACAT's Environmental Health and Justice Program Director. So welcome, Vi.
My roommate. Good morning. This is Vi Waghiyi. I'm the daughter of the late John and Della Waghiyi from Savunga on St. Lawrence Island. We are located in the northern Bering Sea. We have 2 communities on St. Lawrence Island. Gamble has about 700 people, and where I'm from is Savunga, about 800 people. And I'm also a mother of 4 boys, and I have 2 granddaughters. I've been with ACAT, as Diana mentioned, since 2002. And I began working with Alaska Community Action on Toxics as an assistant coordinator. I had read an article, a press release ACAT did about the PCB levels in the blood of our people on St. Lawrence Island. ACAT begun our community-based project with our communities and leadership since in 2000, when a former health aide, Annie Aloha, started noticing a lot of cancer in our people, our families who had lived, worked, or camped at Northeast Cape, one of the former East defense sites on St. Lawrence Island. The military came during the Cold War and established 2 bases on our island in the late 1940s, early 50s, and they occupied our island until the 70s. And we have identified PCBs, pesticides, heavy metals, massive fuel spills, and this has resulted in health disparities, including the cancers Annie started noticing. She was a former health aide, a really respected elder in our community. She tried to get help for our people for 20 years, and nobody would validate her concerns. And fast forward 20 years later, our executive director, Pam Miller, heard Annie at a women's conference here in 1997, and basically listened to Annie and was ACAT was, or Pam at the time, was like a last resort for Annie in trying to get help for our people. She also noticed low birth weight babies and miscarriages. These were illnesses never seen before in our people until after the military left. And when I read the press release about the PCB levels in the blood of our people, which are 69 times higher than the average American in the lower 48, the article really touched me. And I knew about all the high rates of cancers, and I knew about the former 2 former East defense sites on our island. I mentioned the one at Northeast Cape, but the other is on Gamble. The school, the playground, the homes, and some of our city buildings today as we speak are on top of the military contamination. And I was really touched by the article, and later the same week I got a job offer to be the assistant coordinator, and I had to really think about it, but I had no experience or was not even aware that there was research going on St. Lawrence Island. But I took the position because it is so personal. We are seeing so many health disparities in our communities associated with the military contamination. But we're also some of the most highly contaminated population on the planet because of our reliance on our subsistence foods. These persistent organic pollutants, or POPs, these global contaminants, arrive in the Arctic through air and ocean currents, and we're like a hemispheric sink. And so we're being exposed without our consent through our our traditional foods. These POPs end up in our marine mammals at levels we should not be eating them for excess cancer risk. So our communities on the island, we have continued to live a subsistence lifestyle like we have for many, many generations, with our utmost respect for our lands, waters, and air, taking only what we believe the Creator provides for us. The wildlife we have depended on for centuries and many generations. And so a way of life that we're connected with spiritually, traditionally, and culturally, and it's our identity, our culture, and we are one with our lands and waters. And this collaborative on health and environment that resources and publications that Elise talked about are so important because we need to educate healthcare professionals, policymakers, tribal leaders, parents, grandparents about environmental health and how they harm our health and well-being. I never knew how these pops are arriving in the Arctic. As I mentioned, where our hemispheric sink, they get trapped here and have nowhere else to go. I never knew how these the military contamination that was abandoned and buried on our island has been contaminating us without our consent. It's environmental violence. It's harming our ability to have children. It's harming our children's learning and developmental. We're seeing these disparities in our children. Alaska has 2 times more birth defects than the lower 48. But our Alaska Native infants, we have even 2 times more birth defects than non-natives in the state of Alaska. We're seeing childhood cancers. Our cancers are getting younger. So it's so important that I'm grateful that we have these take calls monthly that are free and offered to anybody. And I have a lot of gratitude to ACAT, our leadership and communities, so that we are able to learn how we're being exposed, whether it's local sources like from the military contamination at Northeast Cape and at Gamble, but also sources, as I mentioned, that are arriving in the Arctic, the persistent organic pollutants. And it's so important that it was important to me that we have this Children's Environmental Health Summit because we're seeing health disparities in our communities, not only on St. Lawrence Island, but in the Arctic. One of the big concerns we hear about mostly in our communities in rural Alaska is high rates of cancer. Our people are now know there's changes that are happening. We had never heard of cancer in literature review ACAT did. There was only 1 incidence of cancer in the 50s on St. Lawrence Island, and now we are having cancer crisis and health disparities, and this is very alarming to our communities, our parents, and help's not coming fast enough for our generations. So it was so important that we have this Children's Environmental Health Summit. As Elise mentioned, we had a very powerful panel of Alaska Native women the first day and the first morning of our 2-day conference to share our stories and the lay of the land of what we're seeing in our communities. We had a traditional healer. We had tribal leaders, former health aide. We had a director of and council member from a tribe Department of Health, Education, and Social Services. And as part of our summit, we had experts nationwide and from the globe on policy, research, environment, healthcare, and lastly, education and outreach. But as Elise mentioned, we also had our own Alaska Native experts on these panels sharing our own knowledge of what we're seeing in our communities, firsthand knowledge and wisdom, as Elise mentioned. it's so important that we share our own stories and observations. And to me, because Western science is finally accepting our local, centuries-old traditional ecological knowledge, but when we share our own knowledge of our healthcare disparities, health disparities that we're seeing in our communities, we're still being discredited. So it's important that experts and state and federal agencies hear from us firsthand, because we're part of the solution. It's so important that we work on the recommendations that we heard from the work group members of the summit. We currently have a task force that's going to go forward to address some of the concerns that we heard from the work groups. A lot of them had to do with how we need more research in our communities. We need adequate health care. There's no proper diagnosis and treatment of environmental health effects. We need allies in this work, whether it's decision makers, including policy in our legislative systems, whether it's locally, in Juneau, nationwide, or internationally. We need allies from healthcare professionals to testify, to strengthen our chemical and environmental laws that are broken. So this summit was very important to us, and we have information available on our website of the presentations and PowerPoint presentations, and we're working, as I mentioned, with the task force, and because we're seeing not only birth defects but learning disabilities, asthma, these chemicals, like in my community on St. Lawrence Island, affect the ability of our children to learn. We have the lowest test scores in Sivunga in my community, and this is very alarming to our parents, because how can our children learn? How can we pass on our language? How can we pass on our traditions on how to read the ice and the weather patterns, migration patterns, and how can they learn our songs and stories and our creation stories? And so, I'm grateful for ACAT and Elise and the Collaborative on Health and Environment. And, we have a lot of information for those that have joined us, not only through CHACALS, but our website, and please contact us. It's one of our mission is to educate, offer to educate on environmental health and how they harm our people, not only on our island, statewide, and globally. So I want to thank this opportunity to share our story, and I'll end with that.
Thank you, Vi, as always, for bringing such a personal and community-based perspective to these conversations. Let's see. Next, I'd like to welcome Pam Miller, founder and executive director of Alaska Community Action on Toxics, which, by the way, will celebrate its 20th anniversary in 2017. So I'd like to welcome Pam to share with us the recommendations from the summit. and then we'll have a little time at the end for discussion and questions.
Well, thank you, Diana. And I just want to take this opportunity to thank both Elise and Vi for their reflections on the conference and also for their tremendous leadership in this movement. I just really appreciate that. So in addition to the summit itself and having a great cross-section of students and healthcare professionals, Alaska Native leaders, scientists, teachers, policymakers, and children's health advocates, we really wanted the summit to be a springboard for recommendations and action rather than to just be an end in itself. And the conference was, as noted, really something that emerged out of our real concern about health problems and disparities that we are witnessing in Alaska among our children, and this is what prompted our urgent need to hold the summit this past October. And if you couldn't attend the summit, or if you'd like to hear the presentations again or share with your friends, we do have the presentations, including the video recordings, on our website at acaction.org. So you can revisit and experience it all over again, or if you weren't able to be there, all of that information is there for you. So we wanted the summit to be a springboard, so much of the second day of the summit was devoted to work group discussions in the primary areas of policy, research, healthcare, education, and then outreach and environment. The work groups then provided a series of recommendations and actions that are being carried forward following the summit, and 12 of our participants graciously offered to serve on a task force to implement these recommendations with Alaska Community Action on Toxics. And we had our first teleconference call with the task force on December 1st. And I'm really pleased we have a great cross-section of community leaders, researchers, and healthcare providers on the task force. So I'm very confident that we'll have some good outcomes. So I'm just going to run through some of the highlights of recommendations from each of the working groups. In healthcare, there was a real emphasis on ideas to educate and more fully engage healthcare professionals here in Alaska, a very deep interest in changing the system of healthcare so that it's more responsive to environmental health concerns. In education and outreach, we identified the need to develop educational materials to reduce harmful exposures, and the group prepared a great summary of important audiences to reach through education and outreach, key messengers for those particular audiences, a list of existing resources, and then new opportunities for outreach. And the groups that they were particularly focusing on are parents, as well as healthcare providers, students, policymakers, community leaders, media, and store managers. And they created a great spreadsheet of actions and ways to reach out to those particular groups. So that was a real tremendous effort on the part of the education and outreach work group. In the area of environment, this was chaired by Nsé Witherspoon, the group identified some primary areas of concern for children's exposures, including the ones that we talked a lot about at the conference, indoor and school environments, as well as contaminated sites. These are military and industrial sites in and around our communities. Solid waste and incineration facilities were also highlighted. And then the group really emphasized the particular effects of climate warming in the Arctic as a major concern, because we know that the Arctic is warming faster than the rest of the planet, and it is mobilizing contaminants from ice, from sources in ice such as sea ice, glaciers, and permafrost. And these are this is happening more rapidly with increasing storm surges and the melting of these ice stores. The group also identified a series of recommended solutions to work toward, including ideas for community education and training, youth activities, and working with local stores so that these stores can offer healthier alternatives to people living in rural Alaska. In the policy area, the working group offered ideas about policy priorities at the local level, school board ideas, and at the state level, including support for the Toxic Free Children's Act, which would phase out 10 toxic flame retardants that have particular health harms to children. They also emphasized the importance of implementing the recommendations of Project Tender, that's targeting environmental neurodevelopmental risks. That group had come out with a consensus statement July 1st, including the recommendation for urgent action. And Elise and I have had the honor to be a part of that process as well. And Maureen Swanson, who's the co-director of Project Tender, is a part of the task force going forward. They also identified the need to strengthen partnerships, again, this is a common theme with healthcare professionals, in order to be an effective force for change. They also recommended market shifts toward healthy products, and this is focusing on the retail stores that serve rural Alaska. They emphasized also the importance of strong implementation of the new federal Lautenberg Act, which amends the Toxic Substances Control Act, and especially in enforcing the language to protect vulnerable populations. And then finally, the working group on research had a series of recommendations. One, to develop rapid response toolkits for communities so that they can investigate potentially harmful exposures that might result from industrial or military facilities. And in the longer term, the necessity to cultivate support for community-based participatory research. That includes education and engagement of potential new research partners. And third, the group wrestled with ideas and came up with some recommendations for ways to address health disparities that we've been talking about, and to develop health and effective health interventions to address those problems. They recommended establishing a children's cohort in Alaska to address these key health concerns, and also, again, another common theme here, investigating the connection between climate change and increasing levels of endocrine disrupting chemicals in the Arctic and chemical mixtures. So I'll close there with my summary. There's certainly a lot more to digest here, and we'll make this list available to everyone on the call. The next meeting of the task force is set for early January, so we would welcome any additional people who would like to join, and please let us know if you might be interested. And finally, just to sum things up, Abel Bilt Ito, who is a neuroscientist from the University of Alaska Fairbanks, said that although he knows it's challenging to come up with an action plan following a summit like this, he's not discouraged at all. So I was very encouraged by that statement, and I think all of us feel very strongly that we have a mandate to carry forward these recommendations. We have a good map to carry us forward, and we're very committed to doing that. So I'll stop there and certainly welcome any questions or discussion. Thank you.
Great, Pam, thank you. And if anyone would like to ask a question or make a comment, all you need to do is press *2 to unmute your line. And it's helpful if you also state your name and your affiliation or where you're from. So *2 unmutes your line to participate in discussion.
Well, this is Elise, and I guess I have a question for Pam, if that's all right. Jump in.
Sure.
And given a lot of the recommendations that you just described were made at the summit, which was in October, And given the results of the elections and that you just had your task force conversation, a week ago or so, and I'm wondering if some of the conversation is, given the outcomes of the elections and some of the concern about the president-elect's appointees who may not be as committed to these kind of environmental health goals and climate change, addressing climate change. I was wondering if any of the strategies, have shifted at all, or if there's a need to put a greater emphasis on certain ones. And I don't know if that came up in your conversation with the first task force meeting. Pam?
Pam? There you are.
Oh, hi. I'm sorry. I accidentally muted my line. Well, that's a very, very good question, Elise, and I don't know that we have things fully figured out. But I think everyone is really determined to transcend this repressive regime. But I think a lot of the discussion focused around what we can accomplish at the local and state level and through market shifts, education, outreach, and those kinds of on-the-ground activities where we can really make a difference. And I think we're really still trying to, as I'm sure many people around the country are trying to figure out, how we can work in a positive way given the circumstances at the federal level.
Right.
So still trying to figure everything out, but I think there is a lot in here in the set of recommendations that we can accomplish at the local, for example, school board level for many of the policies, statewide policies, and then really try to figure out where we are with federal efforts.
Right. Well, I think we're all trying to figure it out. It's a moving situation and complex. But I have every confidence too that you all, focusing on the local and state level is definitely the way to go at this time, particularly.
Thank you. If there's anyone else who would like to make a comment or ask a question, please press *2 to unmute your line.
Hi, this is Patty, and I guess this question goes to mostly Pam and Vi, but Elise might have some sense as well. I am wondering, I know that we've talked before on CHE calls, other speakers have talked about the relative lack of, enthusiasm or commitment or something on the part of health for environmental health implications for health and well-being of their patients, and that a lot of that is based on the fact that health education for practitioners does not include environmental health as a factor in health and well-being. And I'm wondering if, as a result of this conference that was attended by some health practitioners, whether you sense any increased enthusiasm for environmental health as part of their education or as part of their practice, or that they would that they themselves would be willing to fight for more of that information to be included in their initial education or their CMEs or something. I mean, it just seems to me like they're sort of critical, and I wondered if you sensed from the summit any change among those who attended.
I'll start us off there, Patty, and I think that's a good question. I think rather than a lack of enthusiasm among healthcare providers, it's more the problem that you also mentioned, which is a lack of education in their training programs. And so I think, part of what we'd like to do and what we have been doing through CHE and other means is to increase the level of education concerning environmental health. And there were some ideas that came out of and I would note also that we had good participation at the conference among nurses, health aides, and physicians. But I think some specific ideas came out to encourage grand rounds, additional grand rounds which offer CME credits for healthcare professionals, roundtables around particular topics of science and environmental health, particular ideas about calls for the CHE calls in Alaska here, and then a new partnership with the All Alaska Pediatric Partnership, again through some of the physicians who participated in the conference, and they were actually very encouraging and interested in furthering our efforts in those areas.
I'll just add, if it's okay, this is Elise, that it's also a systemic concern. You mentioned the educational piece, but it's also how most physicians have to function in the current healthcare system, which is 10, 15-minute meetings with people out of context of their home and family, and trying to make assessments based on very little information, and often then turning to Western pharmaceuticals or whatever to try to help rather than looking upstream. And my experience with healthcare providers is they are very enthusiastic if they just had the time and then also the educational opportunities. And part of the reason why we created a Story of Health, which does provide CE credits for health professionals, so that there's another opportunity for those healthcare workers to actually learn about these concerns. But I definitely hear that it's a big challenge, but I think they're on board if we can just help them get the information they need.
Well, I do believe we're just about out of time, so I think I'm going to wrap it up. If any other questions occur to people, you can feel free to email me at diana@acaction.org, and I will direct your question to the appropriate person. But I do want to thank everyone for participating. Also let you know that we'll be posting an MP3 recording of this call, as well as the additional resources that were mentioned. So you'll be receiving a follow-up. Again, thank you all for participating, and I'd like to ask you to please consider making a year-end donation to Alaska Community Action on Toxics in support of our monthly CHE Alaska teleconferences. Whatever you're able to contribute will be appreciated and will help provide the support we need to continue bringing you these calls in 2017. You can make your contribution online at acaction.org. And yeah, I just again would like to really thank Elise Miller for everything that you've done to support our regional efforts. And thank you, Pam and Vi, for contributing your recommendations and reflections to this call. Have a wonderful holiday season, and we look forward to hearing from you again in 2017. So thank you very much, everyone.
Thank you all. Really an honor to be on this call. Take care.
Thank you. Bye-bye.
Thank you very much.
Thank you.